My name is Claire Taylor. I'm a Macmillan nurse consultant in colorectal cancer at London North West Hospital's NHS Trust. People who have pelvic radiotherapy have some acute symptoms which settle. The most common effects that we know about are changes in bowel function, urinary function and sexual function. Only a significant minority of patients will go on to have these late effects, which may appear months or years later.
I was diagnosed 7 years ago with anal cancer. I had symptoms of diarrhoea. The symptoms didn't start immediately, I would say probably 3 years afterwards. And I was afraid to go very far away from home in case of these accidents happening.
I was diagnosed with prostate cancer in 2009, and yeah, I was totally shocked when I found out. It probably wasn't noticeable for a month or two, and then it gradually dawned on me that the general stomach area was playing up. The symptoms that I had were diarrhea, incontinence, an increasing amount of pain in the pelvic area.
I was diagnosed about 8 years ago with cervical cancer, and as soon as the treatment had finished, I was suffering with abdominal cramps, and I had a thing called bile malabsorption. And then he found a tablet called Colicevalam, which stops the bile acid going straight through your system and making you incontinent. Without Dr. Andrao's help and sympathy, I wouldn't be here today able to do this without running to the toilet constantly.
Really important that you let us know about the symptoms you're experiencing. We want to hear how they're impacting on your life, and we will have some ideas of how we can help you. There is information available, and there are some basic suggestions I'm sure that your GP or nurse specialist will be able to offer you. And if the symptoms don't settle down, then you could ask for a referral to a specialist. There are many specialist centres now in the UK who can offer further treatment.
I wouldn't want anyone to think they got to be on their own and not talk about it. There are organisations out there that are trained to help, that will help and can help. And to sit there on your own is a pointless exercise.
Radiotherapy is a really important modality for treating cancer, and for most people those benefits will outweigh the symptoms that could be experienced later on. It is important to look at the whole treatment in perspective and know that if there are effects, that there is management for them.